Thank you, Governor. Good afternoon, everyone. Thank you for joining us on this May Day. I'll start with the new numbers for today. As the Governor has mentioned, we have 341 new cases. This continues to be reflective of the expanded testing program that we have in place as a state that people are recognizing allows us to test the most per capita of our population in the country. Also then results in identifying additional cases. Of our COVID-19 patients, 352 are currently hospitalized. Of those people, 76 are currently in intensive care units, and of the 76, 51 people are on ventilators. We will continue to see this slight increase and decrease in hospitalizations, but there continues to be consistently a decrease in people in the intensive care units and on ventilators, which is all part of the picture that's important for us to take into context and to make sure that we are staying vigilant, because it's the work that you all are doing that is helping us stay steady with going forward. As the Governor has said also, we sadly have 13 new COVID-19 associated fatalities to report. Our sympathies, thoughts, and prayers are with the families of these beloved Rhode Islanders who we have lost. One person was in their 30s, one person was in their 50s, 4 people were in their 70s, 5 people were in their 80s, 1 person was in their 90s, and 1 person was older than 100 years old. So moving on from today's numbers, I want to take a moment to thank members of our primary care work community. You all have been the heroes on the front lines. You have done and are doing everything needed to help Rhode Island get through this response, both in terms of COVID-19 preparedness work and being able to respond, and in terms of taking steps to continue to provide care to your patients. We've talked in the past about our immunization rates as a state and some of the declines that we have seen there. People have interpreted the stay at home except for critical items that you need to go out for to also mean pulling back from going to get their primary care needs met. And we want to make sure that you hear loud and clear from us that going to the doctor to get routine care or key elements of your health needs met are critical, essential items that you can go out and then come back home for through a stay-at-home order. It's critical that people stay connected to their healthcare providers. It's critical that pregnant women continue to go get their prenatal care services while they are walking through pregnancy. It is critical to make sure that our children and adults receive the vaccinations that they need to continue to stay healthy. If you don't feel well, if you think you need to call your primary care provider, don't hesitate. Definitely pick up the phone and call them. We want to make sure that that relationship continues to occur, that you can continue to get your primary care and other health needs met. It's why the governor, with her leadership, we've made sure that telehealth, being able to talk on the phone, is something that is possible. We are being creative in helping to ensure that you get to continue the relationship with your primary care provider. All primary care practices have managed this period differently, and all practices are going to take their own approach once we start getting back to functioning in a way that feels a little bit more normal. So it's important to check your primary care practice's website. Call if you have questions so that you can become familiar with the best ways to continue to get going again in seeing your primary care provider. The healthcare system and the primary care world are going to get busy again soon. And so we want to make sure that you can take advantage of this time, things that you may have postponed or just routine checks. Call your provider, set up appointments, get going now ahead of the time in the first phase so that you can make sure that you are first in line with engaging with your primary care provider, and that you can familiarize yourself with how you and your families healthcare providers are going to be operating as we continue to take steps towards getting seen again. On a related note, in our appreciation for primary care providers, we want to continue to make sure as we receive it that you are prioritized with having the personal protective equipment, in particular the surgical masks that you need to be able to see patients safely. We very much appreciate that there are well over 30 respiratory clinics in place throughout the state so that people who have symptoms that are concerning for COVID-19 can go to those respiratory clinics. You can either call an urgent care center near you, call your primary care provider, as some of them have respiratory clinics built into their practice, or go to our Rhode Island Department of Health website and click on the respiratory clinics information so that you could see the nearest one to you to be able to get evaluated and tested if you wonder about COVID-19 symptoms. With those separate entities available, we want to make sure that people who are not concerned about COVID-19 can still go safely to their primary care provider, and the providers have the surgical masks, personal protective equipment they need to be able to take care of you effectively. So we've sent out a form to specialty care providers and primary care providers for them to start ordering standard surgical masks, knowing how much we appreciate what you've been doing and how you are the prioritized group that we want to make sure you have in hand. It's an opportunity for providers and practices to fill gaps in their existing inventories for surgical masks in particular. As more personal protective equipment comes in, we're going to get more out to providers and additional types of PPE to providers, knowing that you are our priority group. We do just ask that providers using this new form be patient with us. We want you to receive the masks that we need, and we're going to get out as much as we can, as quickly as we can, and anticipate responding to the request of lots of providers, potentially all at once. So we will push out as quickly as we can in doing that. Before turning things over to Margie and the Governor for questions, I want to make one last note about data. We've posted data online by zip code, and earlier this week I spoke about us posting rates online for our race and ethnicity numbers. Calculating rates lets us accurately compare populations of different sizes. I want to encourage you to go to the website so that you can learn and understand how this is impacting different populations. We now have rates posted for Rhode Island zip codes, with a huge credit to our GIS team and data team who've worked tremendously hard to make this available. We know that we are seeing a lot of cases in more densely populated areas, and people are now able to go on the website and do comparisons and see how different communities are impacted. That helps us understand how those social, economic, and environmental factors play out where you have different levels of quality in education and housing and transportation in those communities. That's part of what we want to address as we work our way through this pandemic response, so that we can have communities bounce forward stronger and better on the other end of this.